Good evening. I extend a very special welcome to our candidates and the viewers across Central New York in joining the Tompkins County Democratic Committee's New York 53rd State Senate Candidates Forum. I am Linda Hoffman, the newly elected chair of the county committee. We are noting a special tribute this evening to the very solid foundation of the TCDC being built through decades of Irene Stein's leadership and significant commitment. In late December, we had to face the passing of Jim Gustafson as the chair. This was deeply felt throughout the TCDC community and beyond. His legacy has and will continue to deepen the power of grassroots politics and is expanding that very foundation of our committee. I would like to introduce the forum moderator, Fred Balfour. He is retired and is a WRFI News Team volunteer. Fred will now open the Q&A. Thank you, Fred.
Thanks, Linda, and good evening. And let me add my welcome to all of you to tonight's forum. We'll start out by asking each of you to simply introduce yourself by giving your name and the city and county where you live, just so we can get a voice print on each of you. Leslie, would you kick that off?
Sure, I'm Leslie Danks Burke, and I live in the town of Ithaca in Tompkins County.
And Leah, you're in alphabetical order next.
Thank you. My name is Leah Webb, and I live in Broome County in Johnson City, New York.
And Amitai, you're next.
My name is Dr. Amitai Warab, and I, like Leslie, am a town of Ithaca resident here in Tompkins County.
Okay, thanks. Let's quickly review tonight's rules. Each candidate will have 2 minutes for an opening comment and 2 minutes for closing. I'll call on each of you in alphabetical order for the opening and reverse alphabetical order for closing. For the questions, I'll call on you in random order and you'll have 1 minute for your answer. Our host, Linda Hoffman, will give a hand signal with 15 seconds to go, and she'll ask you to stop when the minute is up. We're planning to wrap up about 8 p.m. Quick note on the questions. We asked the audience to submit questions over this past week, and we received a rich and interesting set of questions. In some cases, we consolidated similar questions into one, or we reworded either for brevity or clarity. On that basis, let's move to the first question, and we'll do alphabetical order for the first one and then we'll randomize after that. So Leslie, you'll kick it off. And the question is, in your opinion, what are the major issues affecting the 3rd district?
Sorry, Fred, I thought we were starting with a 2-minute introduction.
Oh, sorry. Let me back up. My script jumped on me, and you're right. Let's start with opening questions, our opening statements here. Leslie, you start with opening statement too. My apologies.
Okay, thank you very much, Linda, for putting this event together and Fred for moderating. I'm Leslie Danks Burke. I'm a lawyer. I've been in practice for 2 decades. For the first several years, I focused on international law. I worked on litigation surrounding the World Trade Center attacks. I've represented public housing residents and incarcerated people from foreign countries and women suffering abuse. I have 25 years of legal and policy work advancing justice, like working with Central American farmers, taking on corporate control in the late 1990s, and like taking on police accountability in Chicago back in the early 2000s, when few powerful people in Chicago cared about police accountability. I moved to Ithaca 18 years ago, and then in 2008, I saw Confederate flags springing up all over our rural upstate New York area during President Obama's first presidential campaign. This was nearly a decade before Donald Trump started exploiting those flags and all the secessionist white supremacy that they represent. And I saw corporatization intersect with so-called social issues. And so I shifted my work. I began working with local families to deal with severe healthcare shortages, businesses that couldn't access internet and were getting crushed by big corporate competition, farms in our region threatened by the corporatization of agriculture. I served on the Southern Tier Regional Economic Development Council's Agriculture and Infrastructure Committees. And for the first quarter of this century, we've seen wealth inequality accelerate and real justice remain elusive. So even with this professional background, standing up for economic equality across our Southern Tier and Finger Lakes region, the reason I run for office gets very personal. I'm a mom who simply can't stand down in the face of deep threats to the world our children will inherit. And I'm standing loud and proud for a voice on the Senate floor.
And Leah, not a question, but your opening statement, please.
Thank you for the clarification. So good evening, everyone. My name is Leah Webb, and I am a proud born and raised resident here in the Southern Tier of New York, come from a blue collar family that were very active in their respective unions. And I'm also a proud union member of NYS and UUP. I learned very early on in my experiences growing up here in the Southern Tier, and most importantly, those values instilled in me by my parents, the importance of being our brother and sister's keeper. And so those values help to shape and form not only me as an individual, but also my work as a professional. And so I have an extensive background, well over 15 plus years, doing community organizing on key issues such as healthcare, housing, environmental justice. I also had the distinct pleasure and honor of serving on city council in Binghamton for 8 years, where I worked on a variety of equity-based legislation. I'm a proud product of public schools. I also have my degree in neuroscience, and I'm currently an educator at Binghamton University. And I also, during my time here in the Southern Tier and thinking about why am I running for office, it's very simple. In my work, not only as a national trainer with Vote, Run, Lead, and as a union member, and also as a founding board member of Local Progress, I have found that our communities are tired of leadership not listening, and their lack of listening is coming up in the form of regressive policies that are creating more harm rather than helping our communities. And so that is why I am running. I want to change not only that narrative, but that lived experiences for all of us here in the Southern Tier and Central New York. And it is my pleasure to be here with you this evening. Thank you.
And Amitai, your opening statement, please.
Thank you, Fred, and thank you for having me here tonight. My name is Dr. Amitai Warab. I'm a lifelong New Yorker. I grew up in Rochester, lived in New York City for 12 years, and an Ithaca resident for the past 15 years. I've been fortunate to start, own, and operate several businesses, small businesses here in Ithaca, primarily as a doctor of chiropractic, where I practiced for the past 13 years. I recently transitioned out of full-time practice and into full-time candidacy for the state Senate here in our newly formed 53rd district. I stand on the shoulders of giants here with you tonight. New York was the second to last state to license chiropractic, and several of the people I learned from went to jail for improving the health and lives of the people in their communities, so that over the last 13 years, I've been able to help people regain and improve their health, again, standing on the shoulders of these giants. I'm the descendant of Jewish immigrants who fled pogroms in Eastern Europe on my father's side, coming to America about 100 years ago, seeking freedom and opportunity. My maternal grandparents were the only people in their respective families to survive the Holocaust, with everyone else in their families being exterminated by the Nazis. And the fact that those two people met, brought my mother into this world, makes me the miracle that's here with all of you tonight. Again, I feel very fortunate, very lucky. I like the definition of luck being when preparation meets opportunity. And in that way, I've been very lucky. I've worked very hard for my successes and also recognized the opportunities I've had to volunteer in my community, create and expand access to healthcare for folks here. And we've got a lot of challenges here in terms of healthcare, housing, climate change, and economy. None of these things are going to be easy to remedy, even with a Democratic supermajority in Albany. It's not guaranteed. But my practical lived experience and success is what's going to be giving me the grounding to lead this region and state in realizing our goals, our Democratic Party values, our majority values. And I look forward to earning your support and leading us in that vision.
You guys are skilled at reaching the finish line on target, so thank you very much. Let's get to our first question, and Leah, you'll kick off with the first response. In your opinion, what are the major issues affecting the 53rd district?
So some of the key issues that are impacting the 53rd district, I'd put, and these are my core issues. A big one is healthcare. This pandemic has most certainly opened our eyes to the existing disparities that exist. And so it is critically now more than ever that we pass the New York Health Act. Second, we have issues around housing. Housing is a fundamental issue and need that we have. And so it's critically important that we have more affordable housing in our community. Third, I would also say the environment. We only have one planet Earth, and it's critically important that we work on issues such as climate change and environmental justice. And the other issue that I would like to lift up is the economy. As I said, this pandemic has exacerbated existing disparities, and the economy was not left out in that equation. And so we need good paying jobs that support our families to not only survive, but thrive here in the 53rd district. Thank you.
Amitai, and your response?
Thank you. I would echo much of what Leah just said. As a healthcare provider, obviously healthcare is not only near and dear to me, but I've seen that access to healthcare is a major challenge across the district. So access to affordable healthcare is one of the biggest ones. Also housing, we don't have enough housing stock, and we need to create more opportunities for creating more housing and expanding access to housing, all types. And really jobs in the local economy are what are going to be driving that. So tying that in with climate change and environmental policy, we have an opportunity here in New York State to really be the template, the blueprint, the leaders for creating green jobs, which will not only take care of our environment, but will expand our economy and will grow our tax base to be able to provide the services that we desperately need in the state.
And Leslie, your response?
I see one overarching issue, and that is that families and people across the Southern Tier and Finger Lakes are falling out of the middle class. And I have a plan for how to address that. Our tax structure right now prioritizes the very wealthiest among us, and the rest of us are having to pick up the tab. We have very regressive property taxes. I'd like to see those cut in half in order to make our Medicaid program actually work for the people who it's supposed to be helping. We need to move toward a single payer health insurance system. We need to end welfare for Wall Street and stop tax transfers from going to corporate monoliths and forcing Southern Tier families out of the Southern Tier. With that money, we can get full funding for public schools. We can build union jobs. We can end barriers to transit and housing that push families out of the middle class. And we can build New York State wind, solar, and geothermal jobs that are good union jobs.
Thank you, Leslie. Next question, we'll start out with Amitai first. What is your experience in setting policy in New York State affecting issues important to the 53rd district? And please be specific.
Well, as someone who's been a healthcare provider, small business owner, educator, my purview has been over my clinic, over my classroom, and over my business. So from a governmental perspective, I've never set any policy, but what I can tell you is that I've set policy in terms of, particularly in these last 2 years in a healthcare setting, being at the forefront, making sure that we can, again, access to healthcare access is the key word when it comes to healthcare. So ensuring that people were safe to be able to receive the healthcare they needed and that there was accessibility there. And really setting, as an employer, creating jobs in this district, creating an environment where people can have above market rate wages and know that they can grow in their profession. So again, within my purview, I've created policy as it pertains to small businesses and healthcare in New York State.
Thanks, Amitai. Leah, you're next.
Well, for me, I've had both the experience of being an advocate and a legislator. I was on city council for 8 years, and some of the legislative items that I think are very applicable to this seat is one around the climate. So I was able to, at the city level, implement a climate action plan for our city. We also implemented policy looking at green spaces to ensure that we create opportunities not only to address food insecurity, but also economic opportunities as well by establishing community gardens and urban farms, and even working with our agricultural community on initiatives such as Farm to Table, as an example. I also had the honor and privilege of helping to establish through legislation a Human Rights Commission to ensure that our residents are having dignity in their experiences and living in our communities. I've also passed legislation as it pertains to housing and looking at ways to address vacant properties and really help to incrementally change housing. So those are just a few legislative items that tie into the 53rd district. Thank you.
And Leslie?
We're facing very serious challenges, and we need champions who have defended our values in the toughest environments. And I know, because I've lived it, that honesty and integrity about our values is how we move the conversation. I have a decade of experience as a public advocate, and I'm good at building consensus and moving the conversation because I listen very hard and I'm honest. For 15 years across this region, people know whether they're liberal or conservative where I stand, and that I'm fighting for all of us together. For example, even in very conservative turf, I led the fight for the Reproductive Health Act in our region in New York State, which finally got passed in 2019. I'm very pleased that that got passed because we now see the attacks on Roe versus Wade coming from the federal level. I have regional depth of experience from my work with the Agriculture and Infrastructure Committees of the Regional Economic Development Council, as well as from my legal work advancing business interests. We have to fight even where it's hard.
Thank you. And the next question, we'll start off with Leah answering first. The new Senate district contains two exemplary community colleges, Broome and Tompkins County Community College, better known locally as TC3. Both recently have faced enrollment and financial challenges exacerbated by COVID. Aside from free tuition, what steps would you take in Albany to help those two organizations, institutions, weather and overcome these challenges?
Thank you. So our higher ed institutions are integral partners in our community. And I'm actually a proud graduate of SUNY Broome. And so in thinking about ways to overcome some of the economic challenges that our higher ed institutions are facing is one, we definitely have to deal with the cost of tuition. And so tuition costs are critically important to address. Also, creating clear pathways to education. One of the things that often happens is that there's a disconnect between kind of what do you do when transitioning from K-12 to college. And so understanding that because we have an inequitable system that does not provide wages, for instance, for our families, even once you have a degree, you're still struggling. Those are just some key issues that I think we need to focus on, and making sure that as we're having these conversations with around these critical issues, that we have higher ed institutions along with other critical partners in that discussion.
Leslie, can you give your response?
Sure. I like to say that this is the SUNY district. In addition to those two community colleges, we have a lot of SUNY opportunities in this area, and I think we need a real advocate for SUNY on the Senate floor. I will say that I serve currently on the foundation board of the Tompkins Cortland Community College, and so I'm very intimately aware, especially since I just ended my term as treasurer of that board, of the enrollment challenges that you're describing, Fred. It's deeply distressing that here in a pandemic, when we see such economic inequity, that we are also seeing this enrollment drop. We need to address that by focusing hard on the challenges that keep students from participating in school. One of those that I particularly focused on during my time there was building a new childcare center so that students at SUNY who are in childcare could participate with students who needed childcare opportunities and could make that connection and make sure that we're serving all those students. We have to address the whole 360.
Amitai, you give us the wrap up here.
Sure thing. So I am the product of a community college, starting my collegiate education, and I'm very proud of it. And that was really the steps going on to a doctorate level degree. So ensuring, and I'm also a City of New York graduate from Hunter College. So funding, obviously be great if we can get federal funds, but ensuring from a state level that we're funding CUNY, SUNY, and community colleges throughout the state is critical. I was teaching out in Buffalo last semester, and one of the things that we did in our department was working a lot, really tying in with the community. There was a healthcare hub at Deauville College, and really having the community take ownership and be partners with the school brings more buy-in, will increase enrollment, and really get a mutually beneficial relationship between the communities that these community colleges serve.
Good, thank you. Leslie, you get the first shot at the next question. New York State has taken the lead on equitable implementation of cannabis laws. How will you integrate yourself into the regulation of cannabis sales to ensure the inequities of the past are not repeated?
This is actually something that's very close to me because I've just been approached by Cornell University to teach a cannabis law course. I teach at Cornell University's law school, and they've asked me with my background in agriculture and in law to teach on how the regulatory structure is going to play out for businesses as well as for any other participants in the newly burgeoning cannabis industry. And what we see is that because New York State has not yet promulgated regulations, there is real opportunity for rampant abuse. I'm very glad to see that we have passed this opportunity for cannabis to become a new industry for New York, and also to eliminate the social justice barriers that have really perpetuated Black and brown incarceration. Yet we have to make sure we have the regulatory structure that's going to address that.
Amitai, what's your response?
I will echo what Leslie said and say that we have a terrific opportunity for this to be really an economic engine for us in New York State. But right now we have the opportunity for it to be a corporate feeding frenzy. And if that happens, it's going to drive out the potential for small businesses to be an integral part. And those small businesses make up 90% of the businesses in New York State are small businesses, and they are what make up our community. So ensuring that it's a level playing field, that it's a fair playing field for small businesses to be able to compete with corporations that are not based here in New York State. So obviously it's multifaceted in terms of legislation, and right now there's the potential for it to be, a free-for-all and the biggest, strongest win. So making sure that we're reinvesting in our local communities is where I would focus.
And Leah?
Thank you. I would say that, of course, it is very important to lift up this key question of, well, who has the opportunity? And so in framing our work around that critical question, we can really help to create equitable implementation of cannabis laws. So one of the things I think would be helpful is even working from the state level with municipalities on regulations around just how, for instance, growers and how they have access. Also for folks who are interested in being sellers, what does that look like? And from any type of penalization that may happen inadvertently, because the laws still need to be even more tightened, it's critically important that we're asking ourselves that question of who has the access, who has the opportunity, and what has happened because of certain communities being left out, but being disproportionately penalized with respect to this industry. And so it's critically important that we convene our community leaders and have these conversations around in real time, what are the challenges, but also opportunities for implementation.
Thank you. And Amitai, you're the lead answer on the next one. And housing was mentioned several times in the opening questions. What do you see as the most effective way for Albany to lead on promoting access to affordable housing throughout New York?
it's really increasing housing stock. In a perfect world, I'd love to see mixed income units be the lead there, because part of what makes us, part of our we as Democrats lead with diversity as a strength. And we know that when people of diverse backgrounds and incomes live together near one another, that brings out the best in diversity. So perfect world, I'd love to see incentives for developers to be able to come in and have private-public partnership on mixed income housing. But at the bottom line, any increase in housing stock, whether it's infill in creating housing from former manufacturing, whether it's, what I don't want to see happen is siloing. So I think really increasing housing stock across any level is going to be important. Again, for me, looking at diversity in housing and accessibility and affordability is where the focus has to be, however that presents itself first.
Thanks. And Leslie, you have the second slot.
The real challenge we have in housing is that it's very much a story of the haves versus the have-nots. And here in Tompkins County, we are a very blue county. We are a progressive-minded county, and yet we have seen the decrease in housing opportunities and the real acceleration in wealth inequality drive people out of Tompkins County. Folks can no longer afford to live here. That is a real lesson for our future. We need to make sure that we are investing in real changes that actually will help the least advantaged community members around us. I think it's about a third of Schuyler County's workforce, and perhaps even up to a half of Cortland County's workforce currently commutes into Tompkins County because they can't afford to live here. So we need to recognize that the policies that we've had over the last 10 years, even in a state led by Democrats, have not worked. I was very glad to see Kathy Hochul advance changes to that, yet she has dialed those back in the last week, and we need to make sure that we are creating real opportunities.
And Leah?
I would say with regards to housing and access, it is definitely an issue across the 53rd Senate District and across New York. And during my time on council, I actually helped to lead the fight on addressing housing inequality. Working with programs from the state, such as Restore New York, I was able to implement 40 plus affordable housing units across the city, and also opportunities for home ownership, providing pathways by supporting the establishment of a home ownership academy. And so in thinking even broadly around housing and what this looks like, I also think it's critically important that we, in looking at housing from our rural communities, invest in establishing support for mobile homes, as an example, making sure that they are energy efficient and affordable, and also at the same time supporting legislative proposals such as good cause eviction to ensure that not only do residents have access to housing, but that they can afford to stay there in quality housing. Thank you.
Okay, Leslie, you're up on the next one. And we'd asked the last question on what's the most effective way for Albany to lead. And we wanted to ask about—
Can I just say that I just received a note that the host has closed my video. I wonder if you could put my video back up.
Ted Crane, is Leslie's video down?
It gave me a note through the chat that the host has closed my video.
We had, when we were assembling just before 7, we did have a little problem with Leslie's video. So Ted, are you on this issue?
Try starting your video, Leslie.
Yep, there we go.
There it goes. It used to say I could not do that because the host closed it. So I'm back magically.
Super.
Thank you.
Thanks to the technology controllers in the sky. So we had 2 questions on housing, and the first one we asked about how can Albany lead the way, and the second one was describe your experience on creating affordable housing in your community. And the bulk of your responses to the first one were what you've done locally. And so Leslie, I'd like to kick off with a little bit more expansive view about when, let's assume you win the primary and you win the election and you're driving to Albany and you're thinking of what am I going to do on housing? Can you kind of take that housing question in that context?
You got it. So what I would like to see at the state level is a real focus on new policies that will allow, for example, accessory dwelling units to begin to operate more effectively in our region. I get that you want to have me focus on state level policies. What we can do at the state level is make sure that localities can employ the solutions that we know will work. Again, Governor Kathy Hochul advanced this newly fair housing opportunities in her state of the state. Just in the last couple of days, she has dialed that back. However, if we were to pass the policies that Governor Kathy Hochul has put forward, then that would allow municipalities and county governments to create opportunities to allow more housing to be built in communities and to address that transit problem that I described earlier.
And Leah, you're next, and we're really making a 2-minute answer to this housing question. So have at it, Leah.
Well, that just demonstrates how critically important housing is, right?
Amen. Amen.
So, in thinking about this some more, again, one of the things that I mentioned was the Restore New York program, which was a state program given to municipalities to help address this issue. That's one thing I think would be helpful. Also, from the state level, investing in, as I said earlier, providing energy efficient opportunities for mobile homes. So helping to develop that type of housing in our rural communities as another way to address housing access issues. And also the third area that I mentioned with regards to housing goes to legislation that's currently being discussed right now, and that is good cause eviction. Those are just a few ways, and I imagine that there are others, and looking at, for instance, what the state can do financially to work with nonprofit housing development organizations at the local levels as they are developing housing projects as well.
And Amitai?
Thank you. So there's two sides of the coin of affordability too, and Leslie had spoken about it earlier about how our property taxes are one of the inhibiting factors to home ownership in the state. So there's again, creating more access for people, whether it's for first-time home buyers to not only buy homes, but also to be able to afford to keep them, knowing that they're going to be able to pay their mortgage. And that can go the same as for rents, folks that are renting. Again, creating more housing stock. We have lots of opportunity to, again, like I said, about downtown infill, particularly Binghamton, Tri-Cities, as well as what we've seen happen and can happen in Ithaca. Incentives to build, and again, funding from the state to create more units. More units is going to drive down costs for folks too and expand access.
Thank you. The next question is either the easiest or the hardest. And Leah, you get to start out so you can tell us what it felt like. What is your stance on the New York State Health Act? Would you vote for it? And please start out with a clear yes or no.
Well, this isn't a difficult one for me. The answer is resoundingly yes. And I've had the honor of working as a community organizer on really helping to not only implement the Affordable Health Care Act, but also this particular piece of legislation. As I said, this COVID pandemic has exacerbated issues that have been longstanding in our healthcare system. And our families, unfortunately, are still in this day having to pick between, do I pay for life-saving medicines such as insulin, or do I put food on the table? And so the New York Health Act is a critical and necessary piece of legislation to not only lift the financial burdens on our families, but also to ensure that they have a better quality of life and that their health outcomes aren't simply dictated by zip code or by any cultural background that they may have because of the existing disparities within our healthcare system. Thank you.
Amitai, you're next, and it's near and dear to your heart. We know.
Yeah, I know. Keeping it to under a minute is going to be tough. So, of course, I want to support a New York Healthcare Act that works for all New Yorkers. There's a difference between coverage and access. And as the New York Healthcare Act is written, it's going to provide coverage. There are some things that need to change in it. And again, I'm not talking about gutting it. I'm talking about making sure that we expand access. And that means that you don't have to drive 45 miles to the nearest provider or be able to, or have to wait a long period of time to be able to see someone. We need to make sure that expanding access there's ways to build in reasons for healthcare providers to stay in the state and to want to come to New York State. This ties in with the housing also. You can't afford to be a nurse coming to New York State if you can't afford to live here. So short of it is access to healthcare is critical. Healthcare is the #1 expenditure people are going to have in their lifetimes. We can't have that. That's not sustainable. It's not working. We need something like the New York Healthcare Act to remedy that so that we can put money into our communities instead of the excess spending in healthcare.
And Leslie, take it away.
This is one that's very close to me. Yes, I support the New York Health Act. I've supported the concept since before it was called the New York Health Act, and that's for a very personal reason. I'm the mother of a daughter who had to have 29 surgeries before she was 14 years old. So I have seen up close and personal waiting in hospital emergency rooms and in hospital waiting rooms where every single sector of our society comes through at some point or another, how the healthcare system that we have right now continues to disadvantage the least among us. There's no doubt about that. So I have pushed very hard for the New York Health Act. It's one of the issues that I have been advocating for, especially over the last 10 years in my regional advocacy across upstate New York. That said, the problem that we have with the New York Health Act, it's a very, very short bill. If you take a look at it, it has no pay for in there. And so as someone who cares about that, I came up with a pay for it, and I have a plan for it, and I would like to see that solution implemented.
We'll look forward to that. Next question, Amitai, you get the kickoff on, and it's a long one, so I'll read it slowly. COVID economics have shown us that our family care systems are very fragile and that there are serious economic impacts if and when they collapse. What can the legislature do to make a robust, affordable, accessible, and developmentally appropriate childcare infrastructure available to all New York families?
Well, we need to be funding universal childcare. We can't have parents deciding, we shut down huge aspects of our economy and our educational system when parents aren't able to, when they have to decide, what do I go to work or just stay home? So really what it comes down to is funding for childcare, universal pre-K. In terms of how COVID has affected the economy, we need to look at, obviously there's a lot of things that have been exposed that are issues now. The question is, we're getting towards the tail end of this wave, but we need to be looking forward to what can we do not only to be ready for, but not have the same pitfalls, not go through what we did the last 2 years in terms of how it's affected families and economy. So investing on the front end is going to pay off on the back end.
And Leah?
So yes, childcare is a major economic issue. And as I said earlier, COVID has just simply exacerbated issues around our economy, especially when you think about childcare. It is one of those issues that prohibits a lot of our families when you think about going to work or seeking employment, where you're not having to work 3 or 4 jobs to make your ends meet, and at the same time struggling still to pay for childcare. And one of the things I think would be helpful, and it's also outlined in the Build Back Better bill, is funding for childcare. And that's going to be critically important for us here in New York and across the Southern Tier and Central New York to have access to those resources to help make childcare not only affordable, and also looking at the issue around accessible, working with our providers at the local levels to make sure, do they have adequate resources as it pertains to providing childcare for our families across the Southern Tier as well. Thank you.
And Leslie?
Childcare is something that I have spent a lot of time working on in a policy area for the last several years. As I mentioned earlier, I was very active in helping to get a childcare center built at TC3 so that the community college students who are studying early childhood development can intersect with these students who need childcare and who need that help in order to be able to attend community college. We need those sorts of solutions that link up members of our community who are ready to solve these problems. I also helped to participate in bringing a grant application forward to the Regional Economic Development Council for in-home daycare. That is a heavily underutilized area of childcare, and I'd like to see that move forward more. Unfortunately, during the Cuomo years, childcare was not a priority. That grant was not funded in the Southern Tier. I'd like to see that change. I know that Governor Hochul has really made this a priority and she's acted on that in the past. And so I wouldn't be surprised to see some of that opportunity grow. But right now, we are not getting the funds that were allocated from federal government to childcare. And I'd like to see Albany step in and get us that money.
Next question, I could re-ask it with changing a couple words, but let me shorten it down, and Leah, you take it first. Continuing on the theme of family care, again, thinking about you winning the primary and driving up to Albany after you win the November election, what can you do as a state senator to address the twin problems of understaffed nursing homes and a lack of at-home caregivers for the elderly?
This is an issue that I know too well, as I am caring for an aging parent, as many of us across this region are as well. And so the shortages at our nursing homes are very real and very challenging. And so it's critically important now that in thinking about key investments that we, again, passed the New York Health Act. That is a critical resource that can help when you think about access to care. And also, I know in the governor's state of New York address, there was the conversation around our home care providers. And the big question is, what are they being paid? And the answer is they're not being paid very well, because I know firsthand in working with home care providers that if you are an individual that has complicated health issues, whether it's chronic illness such as diabetes or high blood pressure or any other chronic illness, it is very difficult to get access to home care providers that can provide those services. And so it's critically important that we fund our home care providers in equitable ways so that they are not having to still work 3 or 4 jobs in order to make ends meet. Thank you.
Enthusiasm took you 10 seconds over there, Leah. We appreciate your enthusiasm, though. Amitai.
You know, this is where several issues intersect. Again, absolutely, we need to make sure that everyone in New York State can have a living wage. Leah's absolutely right. Home health care and caring in community settings are underpaid, and we need to at least have a floor for a decent living. The second part of that goes back to the housing issue, which is you got to be able to afford to live somewhere, no matter what you're making. So again, having that living wage is a base. So making sure that we have expansion of access to affordable housing ties in, and then also what we've seen elsewhere is service workers being able to unionize and collectively bargain also makes a difference. That's not going to apply to every setting here, but that's important as well. So getting the other parts of our, the other legs of the stool working is part of what has to happen here too.
And Leslie, it looks like our random number generator is making you last more than it should, but random number generators often do that. So what's your response to family care and home caregivers?
That's okay. I'm glad to hear Amitai bring up the point of unionization at nursing homes. I've been proud to stand with the nurses who are trying to gain unionization efforts at Cayuga Ridge here in Tompkins County. I know also that there's real challenges that we're facing in Broome County with Willow Point and whether there's going to be a privatization there. I want to see privately held nursing homes be held to the same accountability standards that state and public facilities are held to, and the way we do that is through union labor. Absolutely. We also need to make sure that we are supporting our SUNY system that put more nurses into the system. I'm very, very proud that at TC3 we have a great nursing program, and yet we don't have the opportunities available for those nurses to begin to work their life's work and get out there and provide the healthcare that they can. So we need to make sure that our public systems are as fair and equitable as possible.
Okay, thanks. And our random number generator has you up first this time, Leslie, so we're making amends.
I'll be in the middle here sometime.
You will. Diversity, equity, and inclusion. Diversity, equity, inclusion are often lumped together as if they're one thing. That's diversity, equity, and inclusion. Please describe your understanding of each of these terms and some personal experience in promoting DEI. And we'll kick off with you, as I said, Leslie.
We only have a minute, right?
Do your best.
Diversity, equity, and inclusion have been something that the American system has tried to achieve and failed to achieve for 250 years, and we can do a lot better. What I see as the real challenges that are ahead of us are to build on the lessons that we've had in the past and to make sure that we are getting rid of the holdovers from terrible, terrible history in our past. This is not a question that you can address in 30 seconds, but my personal experience, as I've said, is in holding those at the top accountable. For example, back in 2000, before people were really paying attention to police accountability, again, you know, I grew up in the 90s when there was a whole lot of focus on incarcerated people and making sure that we were exaggerating the crime element. I was holding police accountable for their actions. We have to make sure that we're holding every single person at the top accountable for what needs to come next.
Amitai, take it. Diversity, equity, and inclusion.
Yeah, 1 minute's a tough squeeze. So diversity, again, as I said earlier, diversity is, as Americans, is our strength. We are unique in our diversity. As Democrats, that is a strength of ours, is our diversity, to avoid groupthink, to be able to bring different backgrounds, cultural perspectives, and that's what allows for best outcomes. And speaking of outcomes, you know, we can expanding. I really feel like a primary role of government is to expand access and to expand equitable outcomes. And not everyone gets to start from the same place. We need to cast that net wider and again, like I talked about in another section, creating equal opportunities for people to be able to, again, whether it's education, housing, employment. And just real quick about my experience as an employer, I value DEI, and so I've hired from people of diverse, again, upbringing, background, education, and I've been the better for it as a business owner.
And Leah.
Thank you. I guess I go last this time. So my answer to that is simple. Diversity simply asks who's in the room or how many people are in the room. Inclusion pushes us to say not only who's in the room, but what is their experience. And equity asks us who's not in the room and why is that due to systemic challenges. And so when thinking about DEI through the lens of government, I currently work as a DEI educator at Binghamton University. And one of the things that I'm always lifting up are those three frames. And so what can we do as legislators in ensuring that regardless of your background, everybody is entitled and should have access, equitable access to resources from birth. And so it is critically important that when we think about policies that we pass, advocacy that we lead, that is a frame that we do all of our work through, because again, DEI helps to inform not only decisions in the present, but also in the future. Thank you.
And the next question, and we're coming down the home stretch. Amitai, you get to kick it off. Albany has a reputation for being ethics challenged. This is not news. Would you favor stronger punishments for ethics infractions? Describe what you think the most effective watchdog institution would be, and maybe a new one.
That, sadly, that's been the case. And when I talk with folks in the district, voters, that unfortunately is one of the first things that comes off their tongue is like, let's see, look at our history in the governor's office, and historically, what's come out of Albany. Thankfully, we're in a different place potentially, but there have to be, like you said, watchdog agencies or oversight to ensure that it doesn't happen in the first place. Yes, I support stricter punishment for violations, but if we can, an ounce of prevention is worth a pound of cure. So really, that's the question: is how can we make sure that it doesn't happen in the first place? And the nice thing, at least in tonight's forum, is I know both the other candidates. I know they are both of the highest integrity, and I feel very confident about whoever comes out of our 53rd district will be working for change in that respect.
And Leslie, you're in the middle slot.
Ethically challenged is a euphemism for the problems that we have in Albany, and it is a bipartisan or a nonpartisan problem. When we see our elected officials going to jail or forced to resign, as Governor Cuomo was just forced to because of their ethical challenges, it's something that I think affects every single one of us on our own bottom lines when we see our elected officials taking money in order to make certain policy agendas happen. And we need to stand up and call that out. That said, calling it out is not enough. I want to see real changes in a policy level. First, we need to see state senators, like I'm running to be, not allowed to accept outside income in order to eliminate that opportunity for corruption. Second, I'd like to see the elimination of so-called golden parachutes. We just saw Jim Malatros given a $4 million golden parachute, and we could have paid for scores of SUNY students' tuition with that money. He's corrupt, he should go.
Okay, we have one really short question because we got just enough time to do it. Each one of you, and we'll start in alpha order. Leslie, you first. What question didn't we ask tonight? What question would you like to have seen?
I would have liked to have seen a question about how we continue to advance the democratic conversation and what sort of primary we should be having. And I think that probably we've answered that question simply by how the three of us have comported ourselves in this meeting. And so maybe it wasn't necessary to ask, but I think each of us
not too long here, not too long. We're tight for time. We want to
I
finish
still
at
have
8.
36 seconds, it says.
No,
Okay.
I said, this is a short question. We got just enough time for a quick response. So sorry,
Okay.
I didn't explain that. So
Okay, can I just say my point then?
wrap it up.
I believe 100% in an honorable primary, and I can tell my fellow candidates do too, and I'm excited about that.
Dynamite. Leah, what question would you say we missed, or would you have liked to have seen?
I definitely would like to have seen a little bit more about the environment. I know there's definitely a lot of interest on this issue, especially here not only in Tompkins County, but across the southern tier in central New York.
Good point. And Amitai, a quick response, and we'll start after that, the closing statements.
Sure.
In fact, Amitai, you're the closing guy, so answer the question.
Okay.
Kick it
Bang,
in.
bang, huh? Really, it's how are we going to reach everybody in the district? Like I said at the outset, we have majority viewpoints. How do we communicate that with everybody in the district, whatever their letter after their name is? So
Okay,
with that,
closing?
with that, I go into my 2-minute conclusion. Is that right?
There we go. Get your stump
Okay,
out.
got it. All right. So good news, folks. You've got 3 terrific candidates running on the Democratic side in our 53rd district. We have like I said, unique opportunity in Albany to pass meaningful legislation to address not only longstanding challenges, but new challenges of today. And that means we need not only meaningful legislation, but something that's sustainable for all New Yorkers. Currently, there's only one state senator out of 63 who's practiced in healthcare. I've built a 20-year career building bridges in healthcare where none existed, in expanding access to healthcare across New York State, from hospitals in Buffalo, Rochester, Canandaigua, Bath, New York City, as well as here at home for me in Ithaca in our district as a provider, board member at the Ithaca Health Alliance and Free Clinic, and through my volunteer work in the community. That's the kind of background and experience that's needed in Albany when it comes to passing healthcare legislation and expanding access. I've started and operated several successful businesses here in Ithaca. I've created new jobs in this community, not only good jobs with benefits that pay above market rate, but former employees having the opportunity to go on to become nurses, physical therapists, and other. I know what it takes to create good local jobs, and we need more of that kind of experience in Albany. We're coming out of this, like I said, latest wave of COVID, and we really need to not only meet today's challenges, but be forward thinking. My whole career has been in a salutogenic model, which is like building health. And when I look at healthcare, there are aspects of healthcare that are loss prevention, and then there are aspects of healthcare that are health building. And we need to look at how are we going to do both of those things going forward, not just with healthcare, but all the other issues we talked about tonight. So I'm going to ask for your vote, your support in this district, so I can work for all New Yorkers. I'd love to answer any questions that we didn't get to tonight. I'd invite people to visit my campaign website, wardforsenate.com. The email's there. I'd love to speak with everyone who's viewing tonight or views later, and invite you to connect with me. Again, thank you so much to the other candidates, to the committee.
We got to quit. We're running over Pegasus time.
And I look forward to seeing you on the trail. Thank you.
Leah.
Y'all don't play about that time. I know that. All right. So again, thank you all so very much for organizing tonight's session. It has been an honor of mine to not only be a public servant from the standpoint of being in the professional sense, but also personally. And as I mentioned at the top of our forum tonight, those values of lifting up, making sure that we are not leaving people out, are those values that you would want a leader to not only have, but also implement through policy. And so it has been a great honor to say, and most importantly, work not only as an advocate, but as a legislator. And I think that in this time and looking ahead, that our community here in the Southern Tier in Central New York, we deserve to have our voices heard in Albany. And it is critically important that not only are our voices heard, but we're in the room helping to inform the decisions. And when we find that that room is not working for us, we move and make more room somewhere else to make sure that our voices are being heard. And that is the responsibility of a legislator, to take in that feedback and solicit input for the community that you are here to support and serve. And so I think that in moving forward, and why I hope that I get your support, that it is critically important that we have leadership that understands not only those issues, but it's a part of the core of who they are, and that not only do our leaders advocate, but they can deliver results. And I have an expansive track record in being able to deliver results, whether it's on the environment and banning fracking here in the city of Binghamton, whether it's around affordable housing through programs like Restore New York, our healthcare system, being a longtime advocate and fighter for this critical issue, and also establishing economic development opportunities by providing employment preparation with local organizations. So again, please check out my website, leahwebb.com, and I look forward to having your support. Thank you.
Thanks, Leah. And Leslie, wrap it up.
These are very challenging times that we're living in. We see extremists lie about election results and about vaccines and about climate change. Roe versus Wade is hanging in the balance, and we're seeing Wall Street billionaires get richer while our region and our schools and our families are getting shortchanged. And we need a proven champion for our progressive values. I know, because I've lived it, that honesty and integrity about our values is how we move the conversation. Up until just 2 weeks ago, Tompkins County was divided into 3 different districts 3 different state Senate districts, because back in 2010, it's hard to remember that the Republicans were in control of New York State. We had a Republican governor, Governor Pataki, and no one Republican wanted to have all of the liberals in Tompkins County in their district. And so we were divided into 3 separate districts. Now, Tompkins County is put together alongside Broome County, but that does not mean the fight is over. We have real challenges and we need to move the conversation. I have a decade of experience as a public advocate and another decade of advocacy work as an attorney before that. And I'm very good at building consensus and moving the conversation because I listen hard and I'm honest. And I believe that I have the regional depth of experience to deliver and the tenacity to fight even where it's hard. Because we deserve that here in the Southern Tier and the Finger Lakes. We live in a beautiful community and we have very hardworking people and we have all the recipe there that we need for success and the opportunity to succeed, but we have been held back by Albany for too long, by senators' voices who do not represent the people here on the ground who I know are ready for progressive action because I have been building this progressive network across upstate New York for 15 years. So our response to neglect and the extreme right have to be more than empty words, and I'm ready to take this to the Senate floor. Thank you.
Thanks, everybody. And I'm turning this over to Linda Hoffman, and assuming she's going to turn on her audio before she starts giving us a short message on how to watch this afterwards. Linda.
I did unmute myself. Can you hear me?
Yes, indeed.
Perfect. I'd like to really extend a very special appreciation this evening to all 3 of our candidates and also to those that contributed questions. There will be a rebroadcast on public access TV with the schedule yet to be determined. I do encourage this evening's viewers to click the subscriber button on your YouTube screen to receive updates from the TCDC channel and the live streaming link for the 22nd Congressional Candidates Forum for tomorrow, Monday, February 21st at 7 p.m. You can also access our excellent and growing collection of TCDC videos as well. Again, I'd like to thank each of our candidates, and I'd like to thank our viewers for joining us this evening, and good night.